And good morning to everyone. Thank you for listening to Monroe Monday on this Monday, June the 13th. Almost sound like Friday the 13th, but it's June the 13th. It's Monday. Hope everyone's having a great day so far. Have a good weekend. Like I said earlier, it's going to warm up this week. The heat index is going to get over 100. So if you're outside, drink plenty of water, stay hydrated, stay in the shade if you can. If you have some kind of covering put over your head, keep the sun off of you, try to stay out of the sun if you can due to cancer and stuff like that, because if you're prone to sun cancer or skin cancer or whatever. Got Larry over there, he's in deep in thought right now, looking to see what they've got on the menu for today.
That's a good question. Yeah, our menu hotline 270-487-2007, and if you're not around a computer to look at our website, that always gives you a recording each day of what we're going to be having for lunch choices on our steam table bar for lunch and supper and whatever we're having for special for today.
And that's the Heartbeat Cafe there at the Monroe County Medical Center.
Yeah.
Let me tell you what, folks, you get a good portion for a cheap price.
Yeah, that's still good, and with the way prices and stuff are.
Oh, it's fantastic. The last time you were here, we found out about it and had to go over there. And what a find. That is just a jewel.
I appreciate that. I mean, we wouldn't be able to employ as many people, if customers didn't come in from the outside. So it's just, it's a pleasure to be able to do that, serve outside customers and also serve the patients and our adult daycares and a little daycare. We rent out some space too. But yeah, we're open, still required to wear a mask. Hopefully we're working through that,
Well, I don't know. I saw the other day that we're back in the yellow in Monroe County.
Okay.
So,
Well, just have to wait and see then. But if you don't have one handy, I know everyone hasn't been packing one as much. We have some there. We could always give you if you come in. And don't turn around and leave or anything like that.
yeah. But we're talking to Larry Miller. He's the nutritionist for the Monroe County Medical Center, and he's come in today to talk about. I know you're having a diabetic class.
We do. We're finally, even though you said we're in the yellow, we've been approved for, a meeting. And how long has it been, guys? Since
2 years?
Yeah, I'm gonna say every bit, of 2 years since we've had a diabetic support group that used to meet monthly and had an annual diabetic health fair that I can't remember when the last one was. I want to say 2019 sometime. And even, just a community health fair. But the end of this month, June 24th, we're working on a grant with the University of Kentucky. Been working on it for the last 6 months to help uncontrolled diabetics in the community bring their A1C numbers down, which, is kind of your blood sugar reading over the past 60 to 90 days, and just kind of help the physicians' offices, particularly Dr. Tony and Dr. Carter's that are part of the hospital, ones that we manage, implement some things that improves diabetic care. So, keeping your feet healthy is a big thing. Making sure you're talking to your physician about, if you need a statin, and checking your heart health, your blood pressure, your cholesterol, your resting heart rate, things like that, talking to your physicians about your medicines, see if any changes need to be made, and going over your blood sugars. And then part of this grant has offered it's called a Healthy Living with Diabetes class. They've been referring people to, but we've been having some hurdles with that. So we've been referring people from Dr. Carter's office, but they have to go to Scottsville to the health department to attend it. Or our other option was to watch it from a computer and a Zoom setup. So you can imagine, kind of logistics and some of the hurdles that some of our local community members don't have set up, and even some of the rural areas that don't pick up internet that well. So they've offered that class. I told them if they really want to have people and get some of the referrals over there, you need to offer it here at the local medical center. Most people, are familiar with that. Eat there, get some health services there. So that being said, to sum it up, June 24th, we're going to be offering a one-day Healthy Living with Diabetes class. It's going to be from 8:30 in the morning until 4 o'clock. The one kind of thing I got to tell you about it is you do have to register. You say, and that's being in the yellow, they're limited to a certain amount of people. I don't think we'll meet even that amount, but if you are interested, you don't have to have diabetes. You might know somebody with diabetes. You might have a relative with diabetes or a friend you just want to help along with diabetes. I encourage you to, come in if you can and give me a call and sign up. There's the number to the hospital is 270-487-9231, and my direct extension is 1191. If you're interested, call. Even if you don't get me, leave a message and I'll call you back. There's some paperwork that's got to be filled out for the class. Real minor stuff. It'll just be me and you talking about some of that information over the phone, and helps the lady that's putting on the class, Miss Metter from Scottsville, kind of know what to, direct her training towards. Or you could call her directly if you'd like. And her number is 270-237-4423. And she's the dietitian out at Allen County Health Department in Scottsville, Kentucky. So,
what's your limit on people?
We're looking at 12 to 15 right now. 12 to 15. Hasn't been out in the paper, and as I said, we've had a lot of referrals, from the physicians. Our two main physicians' offices already have the chance to attend over these past 6 months, so we're just opening it up to all physicians. And as you might have talked to some of your other physicians, Dr. Bean and Anderson, Dr. Hume, some of the other local ones. I've been by their offices. If you've seen that flyer in the window, or if they've talked to you any about it, this is the first class we're going to offer and see how it does. So I'm excited.
And like you're talking about diabetes, of course I'm diabetic, and I have my A1C checked every 3 months, and of course, several years ago, I'm still overweight, but I was
you were a lot heavier back then. You've done well.
I was almost like 330.
Yeah, you've done well, man. And, you got to give yourself more credit than you do.
My A1C number was like 12, 13, which is off the charts. And of course, they put me on different diabetic medicine, and of course, then I started laying off the sugars, watching my potatoes, my bread, my sweets. I was Mountain Dew drinker, Diet Mountain Dews. I quit drinking those. Started drinking more water, and I didn't really start exercising, but I should have. But started bringing it down, and it gradually started coming down, and I'm down to between 255 and 260 now.
Pretty big loss, man. You're talking about close to 100 pounds.
Yeah, and anyway, looking at my A1C is about 6 now.
That's
and that's
right.
good,
Right. Real good.
So I still got a ways to go, but it's very important to go to the doctor, be checked periodically, get your feet checked.
For sure.
If you need diabetic shoes, your doctor can prescribe you diabetic shoes, and
those are covered once yearly, and on Medicaid, and of course private insurance. If there's some things you don't know if they're covered or not, I encourage you to reach out and check that, because feet health is a big one. I tell some people, you just get to see your local physician sometimes and have other questions, and they're in a rush with patients. One of the big goals of this collaboration was for our diabetics to have their shoes and socks off right when the physician or the nurse practitioner came in. Not so they could just go over and give them, a foot massage, but just to get a quick look, of the parts they can't see, make sure there's no open wounds, cuts, stuff like that. So, yeah, it's
from somebody that has never had it and doesn't know all that much about it. That's exactly what I was going to ask you.
Mm-hmm.
What sort of signs do you have? What signs did you have, Randy?
As far as this diabetes?
Yeah.
Vision, something about your vision, neuropathy.
Dizzy.
Yeah, vision, neuropathy.
Loss of feeling.
Yeah, you just got, you can get numbness in your feet, your legs.
Tingling sometimes.
When they do your foot test, they just use like it's a small prick.
Called a monofilament. Mm-hmm.
They touch you, and see if you say yes or no, if you can feel that. And I mean, it's just a light prick.
Yeah. So loss of sensation, is a common test.
So you're feeling numb. Actually, is what? All right. Let's just say that's why you go into the doc, right?
Yeah. Say if your feet are, for some reason, you've got sores on your feet for no unknown reason, and that's the reason why you have to take care of your feet as far as toenails and stuff like that, because if they get infected, you could lose a toe, you could lose a foot, you could lose a leg, just from
a fingernail being cut wrong. Yeah. So the wound healing slows based on the elevated blood sugars, and then
right.
It cascades from there. So yeah, you're hitting it right on the head.
All right, let's take a little quick break and catch your breath, and then we'll be right back with more Monroe Monday. Welcome back to Monroe Monday, June the 13th. We'll have with us Larry Miller, dietitian, nutritionist for the Monroe County Medical Center. And we're going to talk about diabetes. And on June the 24th from 8:30 to 4, did you say?
4. We might even get out a little earlier, depending on how many breaks we're having. We'll have a lunch. We're going to provide a good, healthy, free lunch. There's a lot of door prizes. So even if you can't stay for the whole meeting, it's not, a have-to thing. We want to get the most out of it. These classes are usually, the way she explained them to me, would be 2-hour classes over, a 3 to 5 day span, but we're just going to try to do it all in one day and encompass everything, see how it goes.
Well, I just wanted to, first off, I wanted to thank Larry Miller, because back, I was having some issues when I had my Rocky Mountain spotted fever, and I was having some real issues in my knees and legs, was really aching and hurting, and I talked to him, and he told me to try some tart cherry extract, and I started taking it, and within a day's time, things kind of went away and helped a lot, And I've had several listeners, call me and say, "What was that stuff you took?" And they started taking it. I think it's helped them too.
Well, good. I'm no medical doctor to give you,
right.
It's not a prescription drug, that. It's, just over the counter. Just helps with inflammation, They make tart cherry juice that's concentrated, or they make the extract that's in the pill. That's pretty inexpensive, wasn't it? Just
yeah, it wasn't very expensive.
Just helps with that. And I noticed, we're pulling ticks off already this year. I don't know. I'm sure you listeners can attest to that. I pulled one off of my littlest girl, and the thing was tiny. Luckily it hadn't been in yet, but I'd be surprised if it was the size of the head of a pin.
Right.
And just they're just invasive little creatures, and
they're out there.
They're out there.
Yeah. Another question I was going to bring up to Larry today, and I've been seeing a lot of pregnant women are having problems with heartburn, acid reflux, and they're having a lot of swelling this summer. Any natural remedies that you can think of?
When you texted me about that this morning, some quick things that popped in my head, that you already, elaborated on right from the get-go of the show, was staying cool, wearing that cool, loose, light-fitting clothing, anything that helps breathable, helps keep that heat down, but increasing your water intake, drinking more water and more fluids will help flush that. Also decreasing your sodium intake, which as we all know,
You know, a lot of people
Colours.
think, you know, you're swelling, you have fluid intake,
right.
but you need to take more fluid in to
Mhm.
flush it out.
To flush it out, yeah. And another big one, when you're done with the day, if you've been on your feet for long periods of time, you know, when you sit down, maybe get in a recliner, elevate your feet some, or if you can elevate them when you sleep at night. Some of the women, you know, that are on their feet there at work that are a little bit older, work 12 and a half, 13 hours, can attest to that. And also compression socks. I can't say much about them, but that's just been another testament, you know, to me, of other women that work in the hospital. They're on their feet a lot, keeping those compression socks that come up over their knees, and when they're going to be on their feet for long periods of time.
Yeah.
Mm-hmm.
Now, what about heartburn? Is there anything in particular?
Might have to refer to Terry on this one, you know. I've never had a child, but it does seem to happen a whole lot. I think more than anything, it's to do with, you know, the way the baby, where it's at. Some of the other things.
I know people said they've tried milk.
Yeah.
They've tried
Milk makes mine worse.
yeah,
Peppermint.
some people does.
Peppermint makes mine worse, and that's a big one.
Yeah.
I always thought that was odd.
Yeah, of course, talk to your doctor. Tums are mostly a calcium, you know, carbonate or some type of.
I lived on Tums with my oldest.
I saw a poster where they said watermelon. would help. Watermelon would help. Of course, that's going to help also with your swelling because it's
Watermelon?
got a lot of water in it, so that's going to help your swelling also. But
One other one that I pulled up here said basically too, just your hormones, progesterone, also called the pregnancy hormone, because it nurtures your womb and the baby's inside it, is the leading culprit behind pregnancy-related heartburn. So those hormonal changes, you know, we got to take those into effect. That all that stuff's going on, all those changes in hormones. Hormones are, you know, they're a tricky thing. They might be produced in one area of the body and have 4 different effects at another one. So
it's what works for one don't work for the other.
exactly. The growing baby might be one of them too. And then one of the other big ones is if you can slow your digestion. So slow your transit time of food through your digestive system, and there's a couple ways to do that. Okay, number one way would be to increase the amount of fiber in your diet, because it delays gastric emptying. Kind of real good with diabetics, because if you take in, say, a Mountain Dew, you know it's all sugar, it's digested real fast. If you take in a pinto bean, might have the same 45 grams of carbohydrate, but it's digested at a slower, more steady, consistent rate. So you know, delayed gastric emptying of the macronutrients. When we talk about the calorie content of food, they are the protein, the carbohydrates, and fats that are in food. Fats usually take the longest to digest. Proteins are second, and carbohydrates are usually quickly digested, and sugars even very quickly. So by having a little bit of fat and protein with the food might help delay gastric emptying. But,
Now, what I was thinking, the folic acid that the doctors recommend, the prenatal vitamins.
Right.
Would that have anything to do with the heartburn?
you know, I would refer that one to a pharmacist or my physician, healthcare physician. But I wouldn't think so right offhand. And you need it. That's it's fortified in a lot of breads and food, and it's essential during that early stages of brain and baby health. To that, I just don't know. I'd have to refer to somebody more knowledgeable on that one.
All right.
Yeah.
All right. Once again, June the 24th. Give us the phone numbers.
Yep.
And
June
information.
24th.
Brandy,
Yes.
had one thing.
Yes.
It's huge. It really does help. Sleep on your left side.
Sleep on your left side.
Mm-hmm.
I've heard that one too. Just a good one to bring up there. You know, it was just.
Any particular reason?
Something about the way it drains.
Yep, just
And
it
yours.
was just the way. Again, I don't.
That's where your stomach is, right? I mean, the way, because that's what they say with a lot of people that have stomach problems. If you lay down after you eat,
Yep.
lay on your left side.
Yeah.
Yeah, I noticed a difference. If I turn over, it gets better.
So yeah, elevated, waiting some time, and then as Terry said, you know, on your left side, if you got a pillow or something where you could prop that, if you can get comfortable that way, that's a good point. Real good point. Okay,
All right.
give you some dates one more time. June 24th, the last Friday of this month. If you're interested, just need you to register. You don't have to have diabetes. Just got to be interested in diabetes. Heck, if you just want to come out for a free lunch and learn a little bit, come on. The number to the hospital is 487-9231, and my direct extension is 1191. I'll give you a call back and you can get you registered. Or the girl that's actually putting on the program there with me is Miss Amy Metter. She's the dietitian at Allen County Health Department in Scottsville, Kentucky, and her number, just be a one quick call, is 270-237-4423. We're going to provide lunch, breaks, and just, you know, if you don't know if you could come, if you just want to know if you got questions about it, feel free to give me a call. We got a couple weeks, and we'd love to get, you know, half a dozen people out there and have a good class. It's usually more the merrier, and you know.
Also, in Heartbeat Cafe's number one more time.
Yeah, Heartbeat Cafe. If for food number is hospital number 487-9231. Our direct ordering line is extension 1195. If you want to keep that handy. Then anytime you would like to see our menu, our IT has done an excellent job of putting it on our website at mcmccares.com. You kind of see a price list and even some of the individual items. But if you just want to know what we're having for the day, hey, I might come over for lunch. I know it rotates. That number is 487-2007. And that's just, doesn't lead you anywhere. It's just a flat out recording of the day's lunch, supper, and whatever we're having for special.
All right, Larry, appreciate you coming in today.
Yeah, I appreciate doing it. Thank you guys.
So register for the diabetes seminar on June the 24th. And we'll be right back with more Monroe Monday and our next guest.